So I just wanted to make sure that everyone knew that this was mine, and everyone had different band-aids to use with different characters on it. So I chose Spider-Man because why not? Welcome to my channel. If you haven't seen any of my videos before, my name is Natalie. I am a family nurse practitioner, and basically the goal of my channel is to help pre-nursing, nursing, as well as FNP students get through school as easily as possible. I also take a look at personal statements and resumes, so if that's something that you need done, please take a look at the description box down below and it'll tell you about the whole process of how that can be done. So for this video, I thought I'd talk about the different instruments or tools that I use in the primary care setting. I think it's good to know, to have an idea of what you'll be using pretty much on a daily basis, how they work, what they're for, so that when you're ready to start clinical, you know exactly what you're doing as far as instruments and tools, and you can go ahead and see your patients as effectively as possible. For the first thing that we're going to be talking about is pretty much, I think everyone has seen before or know what it is. It's a stethoscope. But just in case if you haven't seen it before or would like to know a little bit more about it, this is what it looks like. It comes in many different colors, many different shades, all of that stuff. So it's kind of cool. It's a little bit more customized to your style these days. So these are the earbuds. This is what they look like. And then these are the tubing, so you can actually hear. And then this is what's called the diaphragm, and this is what's called the bell. So when you're listening to different pitches and different things, you can go ahead and you can actually turn this. So whatever you need to hear, if you need to hear anything with the bell, you can go ahead and turn it. And then what people do is just kind of click it when you have it, the earbuds in your ears, just to make sure that you hear something. And if you don't, go ahead and turn it around, and then it should be on the correct side. But that's kind of how you use stethoscope, obviously, to hear the heart sounds and your lungs, and also sometimes your stomach as well, to see that you're moving and grooving with your gastric sounds and all of that. So you'll obviously be using that on every single patient every single day, because when you see every single patient, the three things that you must do every time is look at their selves generally, look at their cardiac and respiratory system. So that's always, you're going to be using this all the time. So this I got on Amazon. This houses all my tools that I brought to clinical with me. When you go to your clinical sites, more than likely they're going to have everything that you need as far as tools. But if you're at a clinical site that has multiple students and everyone is using the otoscope at the exact same time for whatever reason, you have your own tools. Depending on the school that you go to, I know for mine, they had like a package deal that you can get a set of a bunch of different tools for a certain price, and we were required to buy that. So we automatically had this with us. But there are a lot of tools that you can get on Amazon that I don't know how great of a quality they are for when you start your practice or start working. But as far as a student, it might be good to have it just so you have a set with you, because you're going to be using your preceptor set anyway. So just food for thought. So this is the first thing that I have in my little toolbox. It's a reflex hammer, obviously, to check your reflexes. This came in handy. If you don't have one of these, what a lot of other people did was they took their stethoscope and they used this part of it to act as a reflex hammer. So if you don't have a reflex hammer, probably get one, but if you don't want to, you can always use that. People usually use different things. When I was in peds, some of the my preceptors used their fingers, and they just, did what they had to do, and it kind of served as a reflex hammer. But if you are a student, it's probably best that you use the tools, excuse me, that they want you to use just for practice. And then obviously when you're in your practice, you do what you want. So that was the first thing. This is what's called a tuning fork. You'll learn all about it in school. Basically, it's a check for hearing. Excuse me. And you will do the Weber and Rhine test. You will go ahead and learn all about that, but this was handy. Didn't really use this super often, but if you have a patient that has hearing loss or hearing complications, this is something good to use. Sorry, having a little coughing attack here. But anyway, so this is another test. This is for vision. It's just kind of like a pocket Snellen test in a way. So I just had this with me. Or you can go ahead and, if your patient comes in complaining that they're not seeing as well as usual, you always want to check their acuity level of their vision. You could always just say, hey, can you look at that poster and tell me what it says? Or, tell me the smallest line that you can read. Or if you don't have anything in the room, you can go ahead and have one of these. This was part of our little packet that we had, or package that we had to buy. So this came included. So that was really good. The last couple things that I want to talk about, this is an otoscope. And the reason I have a Spider-Man Band-Aid is because in peds, we were allowed to charge them. So I just wanted to make sure that everyone knew that this was mine, and everyone had different Band-Aids to use with different characters on it. So I chose Spider-Man because why not? But anyway, so for this, I have, this is an otoscope. This is to check your ears. And you can see that's where you would see right here. And then here is where you would put in the patient's ear. And of course, there are little cartridges that you put on top just so that it's cleanliness and it's hygiene, and you're not gonna put this obviously in someone's ear. Plus, the little cartridge has like a little thinner part at the beginning, so you could obviously get into the ear canal easier. But what's kind of cool about this is that you can remove this. For some people, they have ones where it will be able to charge. I don't have that one. I have, I think this is a little bit cheaper one, but it's okay. It worked very well. These are battery use, so you can go ahead and check that. But then some of them are a little bit more expensive and you'll be able to charge it. I would recommend to get that just because I think it's a little bit better quality. But you just go ahead and screw this back on. And what's cool about this one, and I tried to find the cartridge, but I just couldn't, is that this can serve as an otoscope or an ophthalmoscope. So basically here, this is what's attached. You can just push it and it pops off. And then you can put the other little cartridge on there, which is the ophthalmoscope. So I'll put a picture of that probably here somewhere so you can just see what it looks like, because I just cannot find mine. But that's really cool because you kind of have two tools in one. So this, go ahead and just push it. You see how it has like the little, let me see, I can't really see, right there. So you just go ahead and push it and then just turn it, and then you have it. Another thing that's cool is that you see this little green light right there. So you press it and then you turn it, and then you can't really see. I don't know if these batteries are working. Let me see. Yeah, I think I need to get new batteries. But anyway, when you have a brand new one, you press this green button and then you just swivel it, and then the light is gonna come on here so you can actually see. And then you can just push it and put it back, and then the light turns off. But yeah, so that's pretty much all the tools that I used on a almost daily basis. Again, this probably used once, if anything, but anyone that has a hearing issue or they feel like they can't hear as well, just go ahead and pull this out and just check to see, because it's good practice anyway. But obviously you're going to be using the stethoscope pretty often. You're going to be using the otoscope pretty often, the ophthalmoscope. The ophthalmoscope little cartridge that came with my little package is so difficult to see. I think a lot of students don't actually see almost anything or don't see very well. There was a cartridge that my preceptor had that was kind of more high tech, and you saw a lot better with that. But don't feel discouraged if you can't see anything, because it's really not that easy. And if you have a patient that has any eye issues, you would go send them to either an optometrist or an ophthalmologist anyway. But yeah, that's pretty much all the tools that we used all the time. And then again, I have different videos talking about different questionnaires that we use, different apps that we use. So you're pretty much prepared of how to use everything. What I recommend is, whether your school asks you to buy these tools or instruments, or if you have to buy it on your own, definitely get a set so you can even practice on your family members or friends or anything like that. But definitely have your own set. You're probably not going to use the set for when you're actually in practice. You'll probably need to invest in higher quality instruments, especially depending on what specialty you end up in. But this is good practice just for now. Get something on Amazon. And yeah, so thank you guys so much for watching. I hope it helped kind of figure out what you need. Remember to always believe in yourself, and have a great morning, afternoon, or night. All right, bye guys.